Hi, my name is Rebecca Brummer, and this is for class Nurse 447, Issues and Trends Facing Healthcare. I chose to do my PowerPoint presentation on nursing and working long hours. Nurses typically work long hours, generally anywhere from 6 hours, 8 hours to 12 hours, which usually turns into 13, 14, 15 plus hours. Nurses who work long hours are at risk for short sleep durations. Those nurses working a 7 to 7 shift, generally a lot of times they don't get out of there until 8:30, and then to have to drive home and then kind of settle down for the night, and maybe if they have to get up and go to work the next day, they're getting not the recommended 7 to 8 hours of sleep. They're also at risk for more sleep disturbances through the night. Getting insufficient sleep increases the risk for reduced performance on the job, obesity, chronic diseases, fatigue-related errors such as medication errors, forgetting to report something to the next shift on your patient, also harm to patients and others. 32% of all nurses report that they are not getting enough sleep. Day shift nurses report getting only about 7 hours of sleep, while permanent or rotating evening shift report 7.6 to 8.1 hours. Permanent night shift report getting 6.6 hours of sleep, and rotating night shift reports 5.9 hours of sleep. Getting 7 to 8 hours of sleep is recommended each night and is also associated with lower risk of obesity, diabetes, high blood pressure, myocardial infarction, cerebral vascular accidents, and injuries and errors. Again, with the medication errors, forgetting to report something onto the next shift, or forgetting to report something to the doctor that's very important for the patient. Not getting enough sleep can slow your reaction time. It also reduces the ability to remember and learn new facts and motor skills. So if a nurse from the previous shift tells you something, you may forget that they told you something, and could be very detrimental to your patient if it's something important for them. It's also people who are sleep deprived are very irritable, in a bad mood, have reduced communication skills. I know this is true for myself. I don't like to talk to people when I'm tired, and I get very irritable. And inability to cope with emotional demands of the workplace, especially now during COVID. There are many admits and having to wear the appropriate PPE with your N95s and gowns and gloves. It's very difficult to keep up with the demands. If you're very tired and you're told you're getting another admit, could make it very difficult for some people. Nurses who worked over 8 hours have a negative effect on your sleep, and those working overtime report shorter sleep and more sleep disturbances. Different negative effects of working long hours include difficulty falling asleep. When I work 12 plus hours, it's very hard for me to shut my mind down and thinking about all the things that I did throughout my shift and what I missed or what I didn't miss. So this is very true for a lot of people, being able to shut their minds off to go to sleep. You're also at risk for more arousals during sleep and early awakenings. Poor sleep quality and shorter sleep durations. Nurses that work long hours are at higher prevalence of depression and anxiety disorders, high blood pressure, diabetes, coronary artery disease. Also, their reduced situation awareness can impair a nurse's ability to respond to patient care needs. If a patient calls and needs pain medicine or needs to go to the bathroom, the nurse may have so many other tasks that are on their mind that they forget, and the patient either has a fall or are in so much pain that it takes forever to get their pain back under control. Also, at increased risk of needle stick injuries because they're too tired and not paying attention. Work-related illness, which can also cause you to be away from the job for longer if you have to stay at home. Increased fatigue, poor mood, poor recovery from work, and reduced perceived health. You may think that you're doing fine, but you're really not doing fine. One of the reasons that a lot of nurses are having to work longer hours is because of the nursing shortage. So a lot of nurses are required to work longer hours or are picking up extra shifts to help so that they're not short-staffed. Also, the mandatory overtime. Some solutions for this is open communication with supervisors, and also invest in a good quality shoes because you're going to be up on your feet most of the day. Also, finding ways to deal with stress, fatigue, and burnout. If you feel like you just can't do it anymore, then you need to let somebody know that you need some time off. If you need to talk to a therapist or a counselor, then definitely let somebody know that you are needing some help. Some more solutions include being an advocate for changes in your workplace. This could be asking for more help, offering new nurses better pay, more incentives to keep them there so that everybody else isn't having to pick up extra shifts and working overtime. Also, become an active member of your professional associations. Always support and respect your fellow nursing staff. Be mindful and focused when providing patient care. That way, medication errors are limited. You make sure that your patient is taken care of. And being able to recognize the signs and symptoms of fatigue and lack of sleep and make the necessary changes. If you have to say no to extra shifts, say no to extra shifts. Also, make sure to get adequate sleep or rest. If you feel like you are not getting that, you need to let somebody know. Some more solutions include limiting your shifts to 12 hours or less. A lot of times this isn't always able to happen because most nurses work 12-hour shifts and then they end up being 13 or 14-hour shifts. Work 40 hours or less per week if possible. Eliminate the mandatory overtime. If hospitals could provide sleep rooms for nurses who need it. Also providing them transportation when they're too tired to drive so that they don't have an accident and potentially harm themselves or others. And let the nurses have a right to reject work assignments if they don't feel like they can work any overtime or any more extra shifts. They need to have the right to be able to reject those assignments. These are the references that I used. I hope that you enjoyed my presentation. Thank you.